Nestled in the middle of the megalopolis of Mumbai lies King George V Memorial Trust and Infirmary, a verdant patch in the midst of a concrete jungle. Care and compassion, its trademark. Service to suffering humans, its mission. Sukoon Nilaya is one more arm of this service for those in need of palliative care.
We created in this beautiful space a center which we termed Sukoon Nilaya. As the name suggests, Sukoon Nilaya is an abode of tranquility.
We are looking after patients with non-cancer, which is not available in most of the places in the country and definitely not available in Mumbai.
Most often the hospitals, when they have to discharge the patient is not in a position to go home. And so what does the hospital do? Where can they send the patient? Here is a place where they can send the patient till the patient recovers completely from paralysis, physiotherapy is started, patient is eating, the relatives learn how to look after the patient and they go home.
We help the patient to transit from hospital care to home care. So in between we are providing the training to the caregiver.
Palliative care is supportive and compassionate care which should be offered from the time of diagnosis of a life-limiting condition right through the trajectory of that disease to the end of life and beyond, with bereavement support to the family.
Every healthcare professional, be a doctor, nurse, social worker, a counselor, a rehabilitation person, should be aware of the holistic approach to palliative care. It's not just thinking about the physical symptoms and their care, but it is talking about looking at a patient and a family as a whole.
Cipla Foundation's vision in partnering with King George Memorial Trust to set up Sukoon Nilaya is to provide a service so that every patient with any serious illness is aware that they are not alone, that they do not have to suffer with pain, and are confident that they can connect with the Sukoon Nilaya team that is trained and specialized in not only providing quality care but also providing a care of plan.
Two patients may have the same disease, but the way we care for them is entirely different. So palliative care is something that is tailor-made, and the caregiver is key in this entire process. Firstly, we focus on caregiver well-being. That includes both physical and mental well-being of the caregiver. So we do this through counseling.
जेव्हा रुग्ण आपल्याकडे येतो तेव्हा आम्ही त्याची नीड असेसमेंट करतो, ज्यामध्ये आपल्याला लक्षात येतं की रुग्णाला आणि त्याच्या कुटुंबाला कोणकोणत्या गरजा आहेत. मग त्या गरजांवर आपण लक्ष केंद्रित करून कुठली उपचार पद्धती देणं महत्त्वाचं आहे हे ठरवलं जातं. म्युझिक थेरपी असते, इंडिव्हिज्युअल काउन्सिलिंग आहे, काही कॉग्निटिव्ह बिहेवियर थेरपी असतात, आर्ट थेरपी असतात. या रुग्णाच्या गरजेप्रमाणे, वयाप्रमाणे आपण त्या ठरवतो.
Occupational therapy plays an important role in palliative care by giving various activities like shoulder pulley, finger ladder, medicine ball kicking, TheraBand, cognitive games, memory games, puzzles. For fine motor, we give synchronization and in finger movement activities like beats and chain. And to improve vital capacity, we give spirometry. Mirror therapy basically decreases the phantom pain.
As per the patient requirements, we provide disability equipments like airbeds, walker, wheelchair and other devices.
We also distribute disability aids when required, and in some cases we even provide them financial aid. We have 17 very well equipped beds with excellent nursing facilities and all kinds of support staff
We have provided them with Fowler beds which are motorized, air conditioning to keep the environment cool.
At Sukoon Nilaya, we aim to empower patients and their caregivers with as many skills and the information as possible. We organize training workshops for our patients and families to interact with the experts.
At times what happens is, because of age or because of any other problem, the person may use an incorrect posture to sit, incorrect posture for eating, and all this goes a long way in affecting their feeding and swallowing.
People with swallowing difficulties have compromised nutrition status, and that leads to malnutrition. If the patient is having his food and the posture is not good, if he is having the food too rapidly, he might cough, he might aspirate.
Individuals can have different degrees of swallowing difficulties, that is mild, moderate or severe to complete dysphagia. So based on the severity, different management strategies are planned for an individual patient.
इन हाऊस इथे किचन फॅसिलिटी आम्ही दिलेली आहे. प्रत्येक रुग्णांच्या डाएट प्लॅन प्रमाणे जेवण बनवलं जातं, जे पोषण आहार आपण देतो आहोत की जेणेकरून त्या रुग्णांच्या जखमा ह्या लवकरात लवकर भरल्या जातील. या किचनमधून आम्ही रुग्णांना तसेच त्यांचे नातेवाईक, आमचे कर्मचारी आणि इतर कोणी गेस्ट वगैरे जर आले तर त्यांना आम्ही जो जेवण दिलं जातं ते फ्री ऑफ कॉस्ट असतं. ते आमच्या देणगीदारांमुळे आम्हाला शक्य होतं.
We typically admit patients along with a family caregiver to be with us for a period of time where we not only stabilize the patient, but we also train the family caregiver to be able to manage the patient at home. How to prepare semi-solid dysphagia diets or diets for people with difficulty with swallowing, how to spoon feed that patient, how to reposition the patient and prevent bed sores, how to care for bed sores in case the patient has been transferred to us with bed sores. The patient's family members are taught to do dressings, bedside physiotherapy and occupational therapy, monitor if required blood pressure and glucose using the instruments that they would be taking home.
We provide our patients with recreational facilities such as games in the form of carom, playing cards. We also provide them with newspapers and reading material. They have been provided with tablets for individual entertainment.
We are providing IPD, OPD and home care services for patient and caregiver. All services are totally free of cost.
Post discharge, we have tried to reach out to patients through teleconsultation. We provide them free medicines if required for 3 to 6 months and even more. So this way we not only take care of the patients within the facility but reach out to them beyond.
Offering the best possible quality of death for patients and their family. If they would like that to be at home, then we would like to offer our care telephonically and with the help of a local general physician, so that the best possible quality of death can be given for this patient. And also we will concentrate a lot in caring for that caregiver through this difficult time.
We basically aim to empower that caregiver to be able to be confident to take the loved one home and care for them at home.
यहाँ से तो मुझे बहुत कुछ सीखने मिला है. हर चीज़ें सीखने मिली कि किस तरह से अपना माइंड डाइवर्ट करते हैं, कौन से टाइम पे कौन सा एक्सरसाइज करना चाहिए, तो अगर सांस फूल रही है तो किस तरह से सांस लेना चाहिए, बॉडी में पेन है तो कौन सा एक्सरसाइज बेटर है वो बताया गया है, और खाने पीने का कैसा ध्यान देने का, किस टाइम पे खाना खिलाना है, किस टाइम पे मेडिसिन देना है, वो सब सिखाया गया हमें.
They trained us to how to feed the patient through the nose, how to take care of his hygiene. For a fortnight we stayed. If I had to go home direct from the hospital, I would have been unprepared.
I have very good experience about this center. First, I had 10 days stay with free food and accommodation. The food was excellent. When I came from the hospital, I was on wheelchair, but today I can walk, I can talk. When I got paralyzed, I was paying 600 per day for the physiotherapist. But this hospital came free everything, so I am really grateful and God bless you all.
1.5 महिना होता तिथं हॉस्पिटलला. ड्रेसिंग, हाताची एक्सरसाइज, पायाची एक्सरसाइज हे सगळं शिकवत होते.
म्हणजे पहिला काहीच मूवमेंट नाही करायचा, आता चांगली मूवमेंट हातापायाची वगैरे करतो, स्वतःहून उभं राहायचा प्रयत्न करतो. सुकून निलयाचे डॉक्टर आणि नर्स यांची चांगली आम्हाला मदत मिळाली.
आईला माझ्या बेडसोर झालेला आहे पाठीमागे, तर त्या बेडसोरची कशी काळजी घ्यावी हे शिकवण्यात आलं. फिजिओथेरपीचे पण व्यायाम घेतले जातात, म्हणजे आपण इथून पुढे हे शिकून घरी पण जाऊन कशी काळजी घ्यायची याची विषय पण त्यांनी सगळं माहिती सांगितली.
I have a vision for the future of this center to create, for the first time in the city of Mumbai, what I term a garden of tranquility, where you will have beautiful plants, bodies of water, areas of relaxation, and in addition, a butterfly park. We have at the King George V Memorial Trust a 1 acre vacant plot of land. In this area, we propose to build a center of excellence in palliative care, which will encompass the entire gamut of palliative care facilities.
We at Sukoon Nilaya are very keen on spreading education in palliative care.
We hope going ahead, Sukoon Nilaya will not only provide a center of influence for care, but also cater to the training needs of health professionals across the country.
If every healthcare professional is trained into the awareness of this concept, I think we would be really spreading the news of palliative care all over the country.
We hope to be able to convince the university to give us a diploma and a degree course in palliative care, which we will be running from our new facility.
The logo of Sukoon Nilaya beautifully captures our concept. It's a butterfly, it's an injured butterfly landing on a flower for some time, for some rest and respite before taking off and continuing on its onward journey.
We at Sukoon Nilaya dedicate ourselves to the relief of pain and suffering. And we urge the citizens of Mumbai to avail of the all-encompassing facilities at this beautiful and thoughtfully crafted center. Sukoon Nilaya, crafted with care and compassion, is a unique, much-needed gift from King George V Memorial Trust to the citizens of our great city. Surely the heady fragrance wafting upwards from this oasis of tranquility will spread across the entire nation. Sukoon Nilaya, an oasis of tranquility.